Some patients call with financial questions, usually involving dental insurance, and others call simply to complain. Now, dealing with these is beyond the scope of this film, but remember these basics. Don't argue with the patient. Simply emphasize that you understand how they feel and offer to help them resolve the problem. And when you consult with the office manager or the doctor, be ready to share the patient's concern in an unbiased way. Other phone calls may involve referrals from other doctors or callbacks to your doctor from another, and the same may hold true for dental labs. A good way to determine if these calls truly involve one of your patients is to ask for the patient's name so that you can get the record for the doctor. Personal calls for staff members are usually discouraged unless of an emergency nature. The doctor will usually let you know which personal calls she is willing to take during the workday. And finally, solicitation calls are both annoying and disruptive. Don't hesitate to tell the caller that this is a business phone number that is not used for solicitation. If opening the office becomes your responsibility, follow the set routine, and we'll share just a general routine in just a moment. Handling the mail, posting payments, paying bills, making deposits, pulling, filing charts, these are all important responsibilities that may become yours. Others involve processing insurance claims, maintaining reception room cleanliness, verifying upcoming hygiene and doctor appointments. And should it be warranted, you may even be responsible for collection efforts, depending on the size of your office. When working with the patients, the first contact will probably be through the telephone. As we mentioned, try to answer before the third ring. Now, this is the time when your office's image begins to be formed in the patient's mind, so use it effectively to share your doctor's skills and training. Here's a great idea to follow in that first phone conversation. Listen to this script. Front desk. Thank you for calling Dr. Allen's office. This is Kelly. How may I help you? Patient. I'd like to make an appointment. I've never been there before. Front desk. Wonderful. We're always excited to have new patients join us. Are you having any problems now? Patient. No, I just need a checkup. Front desk. That's great. Let me tell you about our office. Dr. Allen is a terrific dentist. He's studied extensively with the country's leading clinicians and faculty, and in fact, just 3 weeks ago, he was in St. Louis for a 3-day course and learned the latest advancement in patient comfort. He's not just up to date on all of the latest dental procedures, he's gentle too. You're really going to love him. In fact, he's my dentist. I'd like to schedule an appointment for an initial comprehensive exam, and then we can schedule a recare appointment after that to take care of all of your hygiene needs. So, how's Monday, December 3rd at 3? Patient. That sounds fine. Front desk. Just let me ask you a couple of quick questions so we can be fully prepared for your visit. Is that okay? Patient. Sure. Front desk. First, who may we thank for referring you? Patient. Sam Baker. He's a patient there. Front desk. Oh, Mr. Baker's a wonderful man. It was so nice of him to refer you to us. You can see what happens. The patient has a heightened awareness that this office is different. You've begun developing value in their mind, which goes a long way toward helping them accept the treatment that they may need. Before ending the call, make sure they know to bring any insurance information with them. Don't blatantly ask, "Do you have insurance?" Some patients may feel inadequate if they don't have any insurance, fearing inferior care. And others may worry that the fees may be higher for those with insurance. Patients don't always think rationally. Who does? Instead, ask questions like this. Is there any insurance information we need to be aware of? Or, if you have insurance you'd like us to help you with, be sure to bring the information with you. When dealing with emergency calls, patients of record deserve priority for true emergencies, meaning bleeding, swelling, or severe pain. Less severe needs can be dealt with on an individual basis as time allows. When new patients call with true emergency needs, this is a great opportunity to make a friend and help your practice grow. Most likely, you'll have buffer time set aside for these people. Use it for true emergencies. If time doesn't allow for seeing them immediately, and their need is great, help in whatever way you can to get them healed and out of danger. When you make that patient's first appointment, it should be with the doctor first. not with the hygienist. Now, if your doctor's system is different, honor it. Otherwise, encourage the patient in seeing the doctor first. You might say something like this. Front desk. Miss Smith, we invite our new patients to an initial exam with Dr. Allen. Now, because every office is different, we'd like to perform a complete evaluation of your mouth to make sure that it's in excellent shape. Our goal is for all of our patients to keep their teeth for life. There are many new technologies and opportunities today that help people with both their obvious and even their less obvious dental needs. I'd love to schedule you for an initial comprehensive exam with Dr. Allen, and then we can schedule the recare appointment to take care of your hygiene needs. How's Monday, December 3rd at 3 o'clock? The point is to begin building the doctor-patient relationship early on. It also sets your office apart from others. Here, the patient is important enough to see the doctor first, not the hygienist. When a patient arrives for her appointment, it's their second chance to evaluate you in your office. To begin creating a fabulous image, consider an introduction script that sounds something like this. Front desk. Hello, Miss Smith. We've been expecting you. Welcome to the office. Dr. Allen is looking forward to meeting you. If you'll just have a seat and make yourself at home, Sally will be with you in just a few minutes to bring you back for your appointment. Would you like some coffee, some tea, or orange juice while you complete your patient information and your medical histories? After they've finished, be prepared to give them a new patient orientation packet that has your doctor's biography in it. Now, this promotes confidence. Make sure that the new patient orientation packet includes a list of the services you offer. This promotes education. Share emergency numbers and procedures with them, and this promotes caring. Address the infection control issue and emphasize their protection. This promotes security. List the staff members and list their training. This promotes friendliness. And finally, include several business cards in it. This simply promotes referrals. Tell them something like this as you give them the packet. Miss Smith, we've developed this packet to help acquaint you with our office. We've included a lot of specifics about us and what we offer, and then point some out. For example, here we explain some of our state-of-the-art equipments that ensure the highest quality care. Now, this has Dr. Allen's biography. This shows his attention to continuing education. Now, this packet's yours to keep. Feel free to take it home and read it fully, and if you have any question at all, you can call me. Here's my business card. Now, this is really making your office stand out. When the assistant comes to the front desk to greet the patient, introduce them something like this. Front desk. Miss Smith, this is Sally Adams, one of our doctor's assistants. She's going to take you back to meet Dr. Allen. If you have any questions when your appointment is finished or any time at all, feel free to let me know. And then the assistant should greet the patient warmly. For example, the dental assistant might say, "It's a pleasure to meet you, Miss Smith. We have a few moments before you see Dr. Allen, so let me give you a quick tour of the office." Now the dental assistant can point out the special amenities of the office, like the sterilization area or any high-tech equipment. When you seat the patient, refrain from immediately reclining the chair. This tends to take control away from them. Let the doctor greet them and meet them first. During the patient's care, you're at the doctor's and the patient's service. It's critical that you help the patient stay calm and at ease. Pay special attention to patient comfort. During treatment, keep the treatment field free of foreign items, including saliva, with the high volume and the low volume suctions. Try to predetermine the doctor's needs. In time, through intimate cooperation and experience, your patient may wonder at times if you can read the doctor's mind. When dismissing the patient, first offer them a warm towel to wipe their face and their mouth with. This single touch is one that so few dental practices offer, yet makes such a lasting impression. Our clinical videos show and tell specific ways that you can offer the greatest help to the doctor and the patient in the various modes of dentistry. If you're called to manage front desk duties, from opening the building to doing paperwork, knowing the basics will help make these new tasks much easier. Each office has its own set of opening procedures. Basically, Make sure all the lights and the equipment are turned on, including the suction system and the air compressor, and adjust the thermostat. Prepare the reception area, paying attention to spot vacuuming if needed, and to discarding out-of-date magazines. Straighten the furniture and replenish any drinks and snacks. And don't forget the children's corner. In opening the business area, turn on the computers and check the phone messages and the fax machine. Make sure the day's charts have been pulled and that schedules have been printed out for each of the treatment areas. Verify that lab cases needed that day have arrived or will arrive in time. Check on the reception area several times each day. Many doctors like to keep a fresh pot of coffee on for the patients to enjoy. Make sure it doesn't get more than 2 hours old. When the mail comes, process it according to type. Place all personal mail addressed to the doctor on her desk. Open and place payments near the posting area. Route bills to the bookkeeper. Place new periodicals immediately in the reception area, remembering to discard the old ones. Take all lab cases back to the dental lab. By the end of the day, you may have verified the next day's appointments, filed charts, processed insurance claims, posted payments, made bank deposits, even processed monthly billing statements. At the end of the day, make sure the fax and the answering machines are set to take calls, and back up the computer. Turn off critical equipment like dental units, computers, the autoclave. Set the thermostat up or down, depending on the season, to help save energy. Gather the trash. Set the alarm and lock the office. The business of dentistry is complex. In time, you'll become familiar with most aspects of it. The more you can attend to, the more valuable you are as a dental assistant. Just because an activity doesn't involve direct patient care doesn't mean it's out of your field of responsibility.